Today we're going to be talking about anhedonia. Anhedonia, in its most simple definition, means lack of being able to experience joy, not being able to have pleasure in things that you usually would enjoy. Sports or music or something spiritual or food. You just can't get that pleasurable feeling. I don't know where I went wrong, but the feeling's gone and I just can't get it back. Now, anhedonia is not a diagnosis. It's a symptom. It's a symptom of a diagnosis, the most common being major depression. Major depression, somebody can go through an intense period. It can last for a long time of anhedonia, not able to experience joy. However, it also can be found in people with trauma in their past, post-traumatic stress. It can be found in people with bipolar. When they have the downpour of depression, they can have anhedonia. Even people who have schizophrenia, people who are experiencing psychotic symptoms, they can fall into the abyss where they simply do not experience pleasure anymore. Some thoughts, what happens to people? Yeah, doctor, I hear the music, but I love music, I love piano, but I just can't sit down and get the same feeling like I used to. It doesn't stir me like it used to. Yeah, doctor, I go out with my friends and I just feel like I'm behind a piece of glass. I'm just sort of playing a role. I'm an imposter. I try to put on a smile, but I'm not really there. I'm somewhere else. Yeah, I eat my food, but it doesn't give me pleasure anymore. Everything just sort of tastes the same. Everything is dull. I don't enjoy any of my hobbies anymore. I can't even go on a vacation and enjoy myself. I don't want to call anybody. And it goes on and on. An intense feeling of lack of pleasure, lack of joy. So what's going on? Well, from a scientific perspective, it does originate, of course, in the brain. In the brain, we have those neurotransmitters all around. The main one for experiencing pleasure and joy is called dopamine. And what happens is there's a lack of transmission of the dopamine neurotransmitter. When this begins to happen, then of course people are feeling less joy. This can happen in certain parts of the brain. There are certain areas of the brain that aren't functioning. Also the front of the brain, which is in charge of executive functioning, that can stop working. Amygdala part of the brain, which is the emotional part. You just stop registering emotions like you used to. And it goes on and on. Of course, there can be certain physical conditions that could contribute to this feeling of anhedonia. Somebody can have Parkinson's disease. Somebody can have low-acting thyroid. Somebody could have a stroke. There could be a number of physical things that are going on. You see, what usually happens to people is they do things which are generally pleasurable. And then it ignites let's say a spurt of this dopamine. And then you feel a sense of reward, you feel a sense of pleasure. But in somebody experiencing anhedonia, that doesn't happen. Either because of certain things not going right in certain parts of the brain, or because the neurotransmitter, the dopamine, simply is not working all that well. Those are the physical things behind it. Then there's the psychological. Obviously, somebody who grows up with a very strong negative self-image of themselves. So then they begin to look at life, look everywhere through a negative lens. And then it can be very difficult for them to really expand and have joy. Not only do they not experience joy, but they don't expect to experience joy. And even more so, even when negative things happen, and most people would register sadness or tearfulness and really feel something. The person with anhedonia can't even muster up those feelings. As a result, life is not even worth trying. Everything is muted, blunted. You just can't get it back. You don't even feel like trying anymore. So what to do? Is there a treatment for this? Well, of course there's a treatment for this. First of all, medication can possibly help. Not always, but it certainly can be worth looking into. I would say the medication, the antidepressant that is most helpful usually for anhedonia is Wellbutrin. Wellbutrin, which is responsible primarily for the dopamine pathway and the norepinephrine pathway. The classic serotonin medications like Prozac or Zoloft, they also could be helpful, but sometimes they have a blunting effect and can actually add to the dull feeling that happens with anhedonia. So as far as therapy goes, probably the most common used therapy for anhedonia is what we call behavioral activation therapy. In other words, action precedes emotions. We have to get ourselves into action mode, and then the feelings will begin to follow. If somebody just sort of follows their feelings all the time, well, that can keep them trapped, and they may not ever actually do anything. They wind up avoiding things. And the more they avoid, the more that will breed even more avoidance. So in therapy, we'll look at the inactivity that somebody is doing, their avoidance that they're doing, wasting time. We look at those things very closely. And then to try to get somebody out of the funk, the pit of anhedonia, we suggest little things for them to begin to do, like just take a walk down the street, just a short little walk. Or I know you don't feel like calling your friend, but give them a call anyway. Maybe allow yourself to be a little bit vulnerable. And if it's a good friend, that can begin to open up things for yourself. Or maybe sit down and play piano for 5 minutes. In other words, you may have no feeling going on, but at least get yourself going in some kind of action that can jar somebody out of their anhedonia. Another approach is to recognize that we can have a lot of trapped emotions going on inside of us. We've been hurt in our past. We've had trauma in our past. And so there it is inside of us. We are afraid. We're afraid of anything to reach out, to do something, because we're afraid of getting hurt again. And so we just sit. We sit and we do nothing. It's much safer. It's much calmer, but it doesn't get us anywhere. It's what we call trapped emotions. So in the type of work called emotion code, that can help somebody to release these trapped emotions, and they begin to allow themselves to feel, and it reignites beautiful relationships with their friends and with their family. There's another huge area that has to do, of course, with spirituality. The fact that we do have a soul inside of us, a soul which is pure and which is good. And so even if you're feeling like you don't enjoy anything, you can at least wake up in the morning and the first thoughts in your head or the first words that come out of your mouth could be a sense of gratitude. To have gratitude for the basic things that you have. I mean, if suddenly you woke up one morning and you couldn't see, imagine, and then 2 minutes later you could see, imagine what profound gratitude you would have. To recognize the beautiful things that you basically have every single day. A lot of us, even though we have the pure soul, stuff gets on top of our soul. Stuff interferes with our soul. Stuff covers our soul. And we don't know what to do, how to get out of that. So again, besides giving a sense of gratitude, recognizing that every single morning, to spend some time every day, usually again in the morning, where you do some kind of meditation or mindfulness. Spend some time where you try to connect with that essential part of you. If you can do that, it's sort of like working out. You do that every single day, and that develops, it becomes part of you, becomes part of what you do, and you get more in touch with that essential part of you. I don't know where I went wrong, but the feeling's gone and I just can't get it back. But you can get it back.